Hello, this is Dr. David Bilstrom from the International Autoimmune Institute and Autoimmune Lifestyle. And today on Did You Know, we're going to talk about infections of your gut, your intestines, and how it drives autoimmune disease with some recent infections as well. So here's a clinical scenario. You're a 45-year-old female medical practitioner, and a patient comes to you with autoimmune disease, Hashimoto's thyroiditis, rheumatoid arthritis, and not doing well at all. And you know, just by seeing her diagnosis, you're going to have to run a digestive stool analysis and a GI panel. GI panel looks for things like parasites, let's say, because you know gut infections are such huge drivers of gut disruption, but also autoimmune disease. Thus, they always have to be tested for. But she comes in and she's very worried about her autoimmune disease. You see her med list and she's on proton pump inhibitors. They block stomach acid production in the gut profoundly. And you think, oh no, that stomach acid that's in our stomach, that's there to digest all our food. So you know there's not going to be the kind of digestion of fats, proteins, and carbs we need. But you're thinking, uh-oh, that low pH environment, the high acidity is what also kills any bugs that try to get from the nose and the mouth, float in our world, we swallow them, breathe them, they get down to our stomach, we should be able to digest them with the stomach acid. The proton pump inhibitors don't allow that, and the infections can get down to the lower gut. See it all the time with mold, see it all the time with Klebsiella species, all this kind of stuff, and you go, uh-oh. Well, she asks you, I need some help with all this stuff, but you know, I know my immune system is not good, so I'm really worried about this COVID-19 thing. And you get to tell her, did you know that in July 7th of this year, 2020, in the American Journal of Gastroenterology, they wrote about proton pump inhibitors tied to COVID-19 risk. And what they saw is that people, you said, yeah, you're right, you are at great risk, but also because of your proton pump inhibitors. If you take a proton pump inhibitor one time a day, you have double the chance of getting a COVID-19 infection. You take it twice a day, you have 4 times the chance of getting a COVID-19 infection. That's because COVID-19 can enter the body, floats in the air, hits our nose, hits our mouth, we swallow it, but the stomach acid is there to dissolve it and kill it before it ever gets down to our intestines. Without doing that, the COVID-19 gets in the intestines, and then from the intestine gets in the bloodstream and goes all over to the lungs and the kidneys. So you say, well, we've got to figure out what's going on with your gut. We're going to check for infections. But by fixing your gut and coming off these proton pump inhibitors, we're going to make it so much less likely that you'll get a COVID-19 infection as well. And I want to say a big shout out to people that are really professing you got to wear a mask in this time. Andrew Cuomo, Governor of New York, thank you so much for pushing mask use, because you can imagine if the proton pump inhibitors let those COVID-19 bugs get past the stomach and the intestine and mess us up, a mask is a great way to keep them out of the lungs, of course, but a great way to keep it out of the stomach and the intestines and out of the bloodstream ultimately. Thank you very much.